Welcome back to Fulfillment Therapy, the podcast dedicated to helping parents rediscover their zest for life and find that balance in the chaos of parenting. I'm your host, Kendra Nielsen, and today we're talking about how to recognize when someone you love might need more professional help for their mental health. I get a lot of questions about personality disorders, and it can be very difficult to know if something more serious is going on with your spouse, your child, your loved one, whoever it might be. Before we jump in, I just want to thank you again for all the support you've shown. Go to fulfillmenttherapy.org under Connect, and you can sign up for our weekly emails. Why would you want to do that? When you do, you get those weekly tips on how to improve your personal and family fulfillment. And you also find out firsthand what podcast episodes are coming out, what blog posts are coming out, and any special discounts or awesome things that we have, you would be the first to know. So go ahead and sign up for that on fulfillmenttherapy.org, and you get access to all of those things. Now let's talk about personality disorders. In the past, I've talked about how all of these diagnoses, all these labels, all of these things that are so problem-focused and often are not as beneficial as we would hope. But sometimes they can be so helpful when you feel incredibly lost and you're wondering what's going on. And as you learn a little bit more about it, it helps you grow in compassion and patience. And for those people that are really struggling, especially with those personality disorders that can really challenge any family dynamic. But we're going to talk about some of the big ones today. We're going to think about those people as we're doing this. And obviously, some of those we don't have control over, or we're not able to do much to help them. But when they live in our home, we really need to know how we can help them to the best of our ability. And it starts with understanding what is going on. So I'm going to talk about just a few of the big ones. Some of them I've mentioned before, but just like a refresher to help you understand what they are and take those next steps towards helping them. All right, the first one is BPD, or borderline personality disorder. So BPD is characterized by those intense and those unstable emotions, and even that fear of abandonment or really tumultuous relationships. This is a mental health condition that affects how a person thinks and also feels about themselves and about others, and it causes problems in everyday life. People with BPD often have difficulty regulating their emotions or maintaining those stable relationships, and this can be very challenging if you have a family member with this, especially if you don't know what's going on. So here are some signs of BPD, and you can determine for yourself if this is something that you might want to look into further or get psychological testing for your loved one. It can be that intense fear of abandonment or that pattern of unstable, intense relationships. It might be rapid changes in that self-identity and self-image or impulsive and risky behaviors. They might have recurrent suicidal ideation or those threats of suicide. They might also have intense mood swings that can last maybe a few hours or up to days even, and have that chronic feeling of emptiness. They might also exhibit intense anger problems and challenges controlling their anger that are often inappropriate, and stress-related paranoid thoughts, or even experience that intense dissociation. Now, I can't go into all the ins and outs of all these personality disorders, but I thought I'd give you an overview to help you recognize, okay, maybe it's a little bit more this, so I can go and study this out more to better help them. People that have BPD often struggle to maintain that consistent behavior or those stable relationships over time, and you can see how that could really challenge a family dynamic. Marsha Linehan is the creator of DBT, or dialectical behavioral therapy, and she said, people with BPD are like people with third-degree burns over 90% of their bodies. Lacking emotional skin, they feel agony at the slightest touch or movement. That kind of puts it in perspective for you, doesn't it? I'll give you a quick example here. So a client and his wife experienced this sudden onset of mental illness in their family when their daughter had her first episode recently. And my client talks about how they first thought it was maybe substance abuse or something like that, but later on it turned out to be BPD. I have another client with BPD. Interacting with them can be incredibly confusing, and it's often like emotional whiplash. It's almost impossible to predict how they're going to respond emotionally. And it can be very challenging to navigate, not even on a therapeutic level, but for their family members and all of those people. Now that's just a very brief overview of borderline personality disorder. The next one I've talked about recently, I think, I don't remember when it airs, but I talked about narcissistic personality disorder, or NPD. And this is a little bit more popular right now. Like, a lot of people know a little bit more about narcissism than they have in the past. So I won't go over quite as much with this, but this is where you have an inflated sense of self-importance and that lack of empathy. So those are the kind of key features of it. But this is a mental condition where people have that inflated sense of their own importance and this deep need for that excessive attention and admiration. But they also lack that empathy for others that is so key to having relationships thrive. So what are some of those signs for narcissistic personality disorder? Like you would expect, there's that grandiose sense of self-importance, preoccupation with fantasies of unlimited success or power or brilliance or your beauty or things along that line. They believe that they're special and unique and can only be understood by other special people, so they might seek out those other special people more. And they need that constant admiration. They also have the sense of entitlement, and often in those interpersonal relationships, it can look manipulative and more of a give than a give and take. And like I mentioned before, they lack that empathy, and they also envy others or believe that others are envious of them. So they have this distorted view of the world. They can be arrogant or haughty in their behavior or in their attitudes. And I will point out here that they're not going to have necessarily all of these things. I want you to think of all of this as like a spectrum. It doesn't mean you're super extreme if you have narcissism, but you could have narcissistic tendencies. So keep that in mind. Like, we all have moments where we are definitely narcissistic. But do you really have narcissistic personality disorder? You can actually go online. There's plenty of quizzes and different things that you can take, even for a loved one. I've done that with clients before, to see if maybe their significant other, their child, whoever has NPD, and really determine if it's something that you need to be concerned about. But typically, these first two things are obvious as you learn what the signs are and the general overview of what that looks like in somebody's life. The next one people don't know about quite as well is antisocial personality disorder. And this one can be scary and challenging. Let me explain it and then I'll elaborate a little bit more on this. Antisocial personality disorder is characterized by this disregard for rules and other people's feelings, and it does involve more deceit and manipulation. It did mention some manipulation with narcissism, but this is like next level almost. This is where someone consistently shows no regard for right or wrong and ignores the rights and the feelings of other people. And that's where I'm talking about it can get scary. I don't know how many of you know this, but antisocial personality disorder used to be called sociopaths. So you might be like, oh, that makes more sense. But antisocial sounds so mild. Oh, they're just not social. This is a very frightening thing, or can be if we don't understand it and get that needed help for them. So if you feel like you really do know somebody in your family or another loved one that truly disregards others' feelings and their rights, and they don't really have a moral compass that you can tell, like this belief in right or wrong, it's going to be very important for them to get more help. And I'm going to share some of those signs so you have a better idea. So again, disregard for things that are right or wrong, that persistent lying or deceit to exploit others or harm others. It can be being very callous or cynical and disrespectful. Maybe even using charm or wit to manipulate others, especially for that personal gain or that pleasure. And there's often this arrogance or sense of superiority and being extremely opinionated. They often, not when they're younger, but when they're older, they often have recurring problems with the law and repeatedly violate the rights of others, whether through intimidation or dishonesty. And there's also signs of impulsiveness and this inability to maybe plan ahead. They can be really aggressive or violent, irritable, hostile, and have this lack of remorse for harming others. Often take unnecessary risks or have that really dangerous behavior without care for themselves or even others. They have poor or abusive relationships. They struggle understanding negative consequences or being able to learn from their experiences. They're often consistently irresponsible and repeatedly fail to fulfill their obligations. And so that can further stress the relationship that's already very tumultuous. If you feel like many of these apply to somebody that you know and love, it's important to get them extra help because this can be very scary, not only for the person involved, but for other people in the home, as you can tell, because there's not a respect for the rights of others and there's very little empathy, if any. So, absolutely something that would require more help. And then I just want to share one other one with you. I feel like these are the main ones that I get questions about because they are the hardest to navigate. And this last one is bipolar disorder. Now, many of these can blend with another one. So sometimes it's hard to determine which one it is. So I always tell clients, if you suspect it might be something and it is significantly impacting your life or somebody in your family or the entire family, then get that further psychological testing, those psych evals. And often there's long waits for those. So get on a list right now. As an opening comes available, you can explore more about it. But for at least where we are, many times it can be 3 months to a year before you can get in for testing. So just keep that in mind. So back to bipolar disorder. This involves those extreme mood swings between those manic highs and those depressive lows. This is just a mental health condition like mania and depression. So let me share just a couple signs of that. Those manic episodes are normally upbeat, they're jumpy, they're wired, they have that increased activity and that energy and that agitation. They often will sleep a lot less and they are quite talkative. They have racing thoughts and they're distracted and they often have very poor decision making. On the other side, the depressive episodes, they feel sad and empty and hopeless, often tearful, or maybe even a loss of interest in almost all activities. There can be significant weight loss or weight gain, and even insomnia or sleeping too much, and have that restlessness or that slowed behavior, as well as fatigue and feelings of worthlessness, or maybe a lot of guilt and shame, and that decrease in that ability to think or to concentrate. And often that's combined with thoughts of death or suicide. Bipolar disorder often engage in risky behaviors too, like some of those other ones, and they make these really big plans and spend money recklessly. I'm sure you've heard of somebody, like I know several personally, that when they're in their manic episodes, they just are not themselves. They're incredibly reckless and often get in trouble with the law and just do things that are so unlike them. But then during those depressive episodes, they might withdraw. It's really hard to find them, locate them. And they struggle with those daily tasks and that follow through, even taking medication, doing those simple day-to-day things. It's very difficult for them to maintain that consistent mood over those long periods, consistent mood states over long periods of time. They generally don't see the severity of their mood swings at all. So it's hard to convince them otherwise, like they think they're completely fine and normal. That's not always the case, but often the case. Hilary Moses says this: what we experience as a 3 on the difficulty scale of 1 to 10, they likely experience as an 11. They might be smart and capable, which leaves loved ones scratching their heads when something seemingly simple knocks them down. I can think of several clients and loved ones that I feel have had this, and maybe I didn't recognize it earlier enough. It really is easier to have more compassion and recognize they are dealing with so much more than I can even completely understand. But I can have more patience as I understand this a little bit better now, and even seek much more understanding so that I know how to respond better to it. So how do you know when to seek help? If any of these things persist for months or years, and it significantly impacts work or school or any relationships, and whoever is experiencing these things has difficulty changing despite those negative consequences, and they also lack that awareness of how their actions are affecting others. Now, we can't control everybody, and maybe they are unwilling to listen to what you're saying or unwilling to get help. So what can you do? You can document your observations. You can educate them about mental health. You can consult with a mental health professional. You can encourage them to get an evaluation and tell them about the benefits of maybe doing so. You can research treatment options, especially things like therapy and medication, because this is so beyond just, you should try to be more positive or something like that. A borderline personality disorder diagnosis can certainly make someone uneasy, but with the right treatment and compassionate understanding, it's treatable and does not need to be something to fear. So again, there's so much that can be done, but without that extra knowledge, that extra information, it is going to very much impact home life and relationships instead of the knowledge and the help and the tools that can help take their life to the next level. To have that conversation with this person, maybe they're a little bit older. It just depends developmentally how you would do that. Thinking about that conversation maybe fills you with fear. What are some quick tips you can use to have a conversation like that? You can just choose a calm moment to talk and use I statements like I've talked about in other podcast episodes. But give them specific examples of the behaviors that are really concerning to you. Express that care and that support instead of that judgment and that shame, because all of these, but for many of these, strong elements of shame associated with it when they have a little bit more self-awareness. Help in finding resources or with them to help plan moving forward to improve this dynamic a lot more. About his child room and crying a lot. She had low self-esteem and difficulty with her friends at school. She was easily upset, and my client talked about how it was tempting to just think of this as normal teen behavior. I realized that she was having a lot more bad days than good days, and that just wasn't normal. As he realized this, and as we broke it down and talked about it more, he recognized that there was a need for further testing and scheduled psychiatric evaluation, and was able to get her a lot more help at such a crucial time. The other thing that's very important to remember is when you have a loved one that has a personality disorder or potentially does, it is very challenging for the other people in the home. So it is imperative that you take care of yourself. That is just plain self-care, but it's also setting boundaries, saying no when you need to, building a support network, and seeking therapy yourself. All right, my friends, just to recap that really quickly, personality disorders can massively affect people and their relationships, but there is hope. Even if your child or loved one has those intense mood swings from BPD or needs extra validation from narcissism, or maybe they disregard the rules in antisocial personality disorder, or even has those highs and lows of bipolar disorder, the first step is understanding what's going on and then getting extra help so you can improve your life, because it's often in shambles when this is happening and people don't know what's going on. Remember, this is not just about fixing problems. This is about building a healthier family and happier lives together. And you can't do that unless you're informed and seek help from people if you don't have the background or the knowledge or the skills that you need to help them thrive. My friends, I hope this helped you today. Maybe you're one of those people that just doesn't know what those big personality disorders are, but you needed a little bit more education on what that looks like so you can better know how to help your loved ones. Thank you for joining us today on Fulfillment Therapy. Take care of yourself and your loved ones and take life to the next level. Don't forget to check out our courses that will help you do this on fulfillmenttherapy.org. Remember, we have a personal growth course, we have a marriage course, and we have a business course if you want to start an online business and a podcast like I'm doing. I'll break it down and show you exactly how I did it. And that's that first course in that journey to doing that. We also have more courses coming late spring or early summer, so check those out as well. As always, thank you for listening. You take care, and I'll see you soon.